Hello everyone, this is Dr. Joe. I'm thrilled to share some big news today. It is a little bit past, but it is really important to know. In 2019, the American Diet Association officially added low carb diet to its recommended eating plans for people with diabetes. This is a game changer. I'm going to explain why it is matter and how it can benefit your health. If you find this video helpful, please give it a thumbs up and subscribe for more health insights. The American Dietary Association has a noble mission, preventing and curing diabetes while improving the lives of those affected. Sounds great, right? But here's the catch. Their dietary recommendations have often lagged behind the latest science. For years, their website featured the outdated USDA food pyramids, which pushes excessive grains and starches. Following that advice can lead to weight gains, diabetes, high blood pressure, and high cholesterol. But in 2019, the AD made a historical move by including low-carb diet in their guideline for diabetes management. Based on recent research, they acknowledged that the low-carb diet can lower blood sugar and reduce the need for diabetes medication in people with type 2 diabetes. This is huge. It is surprising to think that the ADA of all organizations took so long to embrace this approach. Believe it or not, the AD first started recognized low carb diet back in 2008. Before that, they stubbornly against it. In 2008, their spokesperson, Albright, stated that both low carb and high fat diets show similar weight loss result after a year. It was a lukewarming endorsement, comparing two diets with very different goals based on solely on weight loss, which felt a bit odd. It is shocking that an organization dedicated to diabetes didn't embrace low carb diets sooner. Their excuse? A lack of sufficient evidence. While it is true that new dietary recommendations need solid research, the ADA often resisted ideas that contradict their existing guidelines. Plus, let's be honest, associations like ADA or even breast cancer organization are often influenced by the sponsors like food and pharmaceutical companies. These groups receive significant fund which can make them cautious about challenging the status quo. They're more like PR driven nonprofit than cutting edge scientific bodies. Why this change matters? The 2019 guideline update is a big deal because it showed the ADA finally had to acknowledge low carb diet even if reluctantly. They dragged their feet as long as possible, but evidence was too strong to ignore. This is great news for fans of low carb, high fat diet, also known as ketogenic diets. If your doctor still warns you that sugar is fine or the fat are dangerous, they're behind the time and need to catch up. The AD announcement specifically cites a 2007 study on ketogenic diet. In this study, outpatients follow a low carb, high fat diet for 10 weeks, resulting in weight loss, lower hemoglobin A1C levels, and reduced diabetes medication use. A 2018 follow up study confirmed that these benefits were stable and effective long term for managing diabetes. So, if you've been hesitant about eating fat, worrying they are some kind of health curse, you can relax. Low carb diets aren't just for people with diabetes, they can benefit everyone. The quality and quantity of carbs we eat today are often problematic. By choosing better carbs and cutting back overall, you're still getting enough without overdoing it. Reducing carb lower insulin levels in your blood, which not only help manage diabetes but also promotes weight loss and reduce inflammation. Lower inflammation means a reduced risk of heart disease, improve cholesterol levels, and even benefit for conditions like thyroid issues or arthritis. For those with type 1 diabetes, Cutting carbs can reduce the amount of the insulin needed, which help with weight management and inflammation control. It's a powerful tool for overall health. A low carb, high fat diet, when it done right, can be transformative. Half hearted effort will only give you half hearted results. So, follow a proper guideline to see real change. The 8-day shift is a green light to confidently try this approach. If this video cleared things up for you, please like, subscribe, and share your thought or experience in the comments below. I'll be back with more practical health tips soon. Thanks for watching.